any change of arrangements for Aboriginal health in terms of any less funding will be devastating for the worst off Australians in terms of healthcare outcomes. This has got to be spoken back to, and we've just got to stem that and argue for increased funding, not less funding. They're really contradicting their policies. They want to start to engage with Indigenous Australians and Underper Health and Aboriginal Health Council of South Australia, community education groups, and yet they want to give us less money to do the heavy lifting. You can't change a lot of Aboriginal people in a cost-neutral context. We need more money so we can strive for equality. I think moving healthcare, moving access to good education from country into cities into regional towns is an absolute disgrace, and it's a strategy to take country away rather than ensuring that we can be closer to country, because that's what we're about. Our language, our cultures, it's all about connecting to land and our seas. And so to move us off that is trying to lessen our capacity to build and have that commitment to country and to build on the legacy of our grandparents and our elders.
What we need to know is that this government has decided to strike at the very heart of what it means to be an Australian citizen.
And the impact on our most vulnerable will again put these people in a more vulnerable position. And we know that when individuals face poverty, their health and well-being will fall away. We would encourage the Commonwealth Government to abandon the $7 co-payment, which is more around $20 to $24. Because we'll end up getting $24. And once you see the doctor, you get your bloods done, and then you send it off to pathology, that's $24. To re-look at the changes for Centrelink for those under the age of 30, pensioners and disability allowance. And to make sure primary health care is easy to access so that we don't have to keep attending funerals for family that have passed away prematurely. The Commonwealth Government has a duty to take care of all its citizens through sensible policy. But unfortunately, this government has forgotten about a large proportion of our community, both Aboriginal and non-Aboriginal.
I think this government's got a long way to go. Even Labor itself has been in collaboration with the intervention in the APY lands in terms of income support. They're in collaboration. I can't see too much difference. What we've got to do is take them on together, because no political party has really delivered the equity and the justice and the sovereignty that we require. Well, I think he communicates too, and with Aboriginal people, he just doesn't listen to the response. So his communication style is about directing and changing and implementing what he wants. He doesn't listen to the response about what we think the impact's going to be on our individual families, communities, and indeed us as sovereign peoples of the first peoples of this country. Until they deliver an understanding our place as the first Australians, and deliver on our knowledges and our culture to be as equitable in terms of the funding that we need to make sure our culture is alive and vibrant. There is a strategy. I think there's a hidden agenda about ensuring that we fade out. The assimilation policies of 1788. Assimilation is just another form of passive genocide. It's violent in a way of its impact, but it's through stealth.
Just the impacts on the budget is going to be pretty hard, and if you look at a whole lot of cuts, I suppose, around that primary health care, and that's really early intervention, and that's trying to get patients, particularly Aboriginal Torres Strait Islander patients, into hospitals earlier, so that we can start treating with illness early to prevent, premature death later on in life through chronic diseases. If you read the budget, it's probably not just the Aboriginal community, but if you're lower middle class, low income, if you're on unemployment benefits, if you have a look at the hidden agenda, I suppose a lot of people are saying, if you've got people that are sick, need to be closer to bigger cities and centres. If there's no employment or no initiative to set up employment in remote areas, well then where are people going to go? If their Centrelink's going to get cut or they can't get employment, they'll end up having to go to larger places, and then probably crime levels, but again, underneath it all, probably a look at the land because still a lot of land that, you know, government would like to get a hold of. You know, I heard Bob Hawke talking the other day, and he was promoting that Australia should be a good universal citizen and set up the remote areas as as a dump place for uranium from all across the world. You know, and if this is the kind of talk from someone who's considered middle, we'll hate to see what the Liberals are planning and the Nationals. Look at the mining boom that's been in SA over the last 15, 20 years. Where's that really? You know, why are we really talking about budget cuts and hospitals in SA, you know? Didn't they put some away in the kitty for, you know, rainy day or something? But again, you know, where's all that gone? A lot of the communities, a lot of places hasn't changed. So we're still facing the same social impact. If you look at a lot of their policies, these are pretty going back to, you know, the white policy days, you know, which was only 1967 it ended, but they've given up hope and faith that, you know, we're actually moving forward as Aboriginal people as a nation. Well, you know, they must have their head some down a rabbit hole or something. Rabbit hole, I bring rabbit hole.
It will mean that our efforts at closing the gap will be impaired. It will make it so much harder to close the gap in life expectancy, in infant mortality, in all of the measures we have about people living long and healthy lives, and the way in which that disparity presently exists between Aboriginal and non-Aboriginal Australians. The greatest and highest priority in healthcare is to get services to those who are most vulnerable. So Aboriginal people are one of the priorities for public healthcare. So any cuts that adversely affect our ability to support our most vulnerable members of our community obviously is disgraceful. And that's what we're fighting against, that's why we're raising our voice today against these cuts. And what we need to do is to make sure that people also remain connected to their spirituality. And so we need to respect the fact that Aboriginal people make choices about where they want to live, and those choices are deeply related to their relationship with country, and that spiritualism is at the heart of their health and well-being.
Oh, mate, they're going to kill us. They're going to kill our mob of sick people up there, and all the doctors and health workers and nurses and sisters. They're going to be laid off. The organisation's going to be closed. Well, I hope not. I hope people can really stand up and give it to this government, give it to the bloody Abbott and what's his name, Hockey and those bastards, because our people will really suffer for sure. And what they need to do is cut back on the war machines, all the money they're spending on troops going everywhere else and killing people. And, they don't need to make us suffer yet again more. So that's what I'm here for. And a lot of these people here are here for the same. They don't want the budget to be cut. They want to keep their jobs. People have got to travel way out in isolated communities and countries. Pretty hard just doing that alone, and then also treating our people. The biggest thing is if the health services close up in the remote areas, then people are going to have to migrate to hospitals in town, and that's not really good. I think these government know what they're doing. They're pretty evil people. That may be it. They get the people removed off the land, grab their land and all that caper. They're pretty good at it. They talk about closing the gap, but this is widening the gap. This is really, well, either widening the gap or closing the gap and stopping people the right of living. There's a lot of sick people out there, and they're sick because of what these people done. So Joe Hockey and Abbott to be instantly dismissed. They should be sacked. And if people don't get in there and do the right thing, sack them as well. So that's what they need to do, instead of pussyfooting around.
This land was stolen from us. And I said that to the Premier, Mr. Weatherall, down at the Gumtree at last Proclamation Day. I had a piece of paper up there with, "This is stolen land." And I said, "This is stolen land." And he said, "Yes, I realise that." And I said, "Well, what are you going to do about it?" And I had to ask him a couple of times, and he said, what do you want me to do? I said, we want to talk to you, sit down like proper human beings, and sit down and talk about our rights, and about signing a treaty. And it didn't happen, but we was able to say, you know, this is stolen land. Until we sit down together and sign a treaty, it'll always be stolen land. They meet together, they have the COAG meetings, and they talk about issues that concern them and what are a threat. And Indigenous people, we're the poorest people in the country, a very, very rich country, and we are the poorest, and yet, you know, they've incarcerated us, they've put us on reserve, removed us off land, stopped us speaking our language, stopped practicing our culture, stole children, took them away, done all these terrible things. Why? We're the poorest people in the country. We can't afford to take them to court and you know, we can't compete with them financially, but morally, they know in their hearts what we know, that this is stolen land. Until we sit down like Australians and sit down and say, yes, let's acknowledge the truth about this country, and let's sit down and work out a way that we could all go forward in the future. Other countries have sat down together, like civilised people, and say, well, let's work this out. We're all Australians. All of our people fought in all of the wars, from the Boer War. They took Aboriginal people because of the tracking skills, expert trackers. They recognised that skill, took them over to the Boer War, and they served the Australian country, and then they left them there. Those people were left there because they was a different colour, and Australia had this white Australia mentality. They had this, no, we can't bring them back here. The donations that's been given to these parties, the big parties, who can compete with that? So we certainly can't. So, you know, who are they going to listen to? When they say this is in the national interest, you know, we govern for all. They don't. There's whoever's given those big donations, who's ever got the investment, that's who they govern for, and they make sure that those people are looked after. And that's not right. And the sooner non-Aboriginal people in Australia realise what's going on, how we're being treated, the first people, the sooner that, you know, and it's happening right around the country with all these cuts. We've got to do something about the system. We've got to say, no, we don't want this future for all of our kids. No matter who they are, whether they come from overseas, whether they're born here, or wherever they come from, we're all Australians, and we've got to make sure that everyone is looked after, not just the rich.
What they're doing is it's going to create a bigger gap with the removal and of $543 million and a further $600 million that Warren Mundine is looking at. So that's over $1.1 billion in a 4-year budget cut for Aboriginal programs Australia-wide, and we couldn't take it, and it would be totally unacceptable, and it would actually widen the gap, not close it.